Started. Well, why don't we get going? Good morning and welcome again to A Healing State of Mind from Crisis to Recovery for All, the 2021 NAMI Illinois virtual conference. Today is our keynote session. The focus is Recovery for All, Facing the Challenge. Just a little background on, then I'll introduce our speakers and we'll get going. With 20 affiliates in Illinois and 600 affiliates nationwide, NAMI is the largest grassroots network working for people with mental health experiences in their family in the nation. In Illinois, we reach about 40,000 with our core programs and much more with all of the things that we do. But there are 13 million people in Illinois. And if you went on our website and checked the, find NAMI by county, you'll see that there's whole areas of the state that we're not reaching. So if we're talking about recovery for all, we're not there yet. In a few minutes, we're going to hear from Dan Gillison, our national CEO, and from Secretary of Human Services, Grace Ho, and Rick Estrada from Metropolitan Family Services. Before we begin, though, I'd like everyone to keep a few things in mind because we're thinking about what needs to change to get to recovery for all. One is that equity is something that we all have a stake in. We need each other. If you look at the increase of distress since the pandemic alone, we need more, a much larger and more inclusive mental health community. And we're not going to get there if we aren't welcoming to every single person. So I would ask people to think, what is your part in this? What is your part in this? The second one is to question our own assumptions about leadership and where that comes from. I believe that the leadership that the state needs and we need for our mental health community is already there, working in our neighborhoods and communities. We may not always see it, though. So I would ask people to think about the question is, who do we need to welcome to the table? And then the third one is to look for systemic and permanent solutions. We've been in crisis for 18 months now. We're beginning to think about recovery. Crisis is about the now. Recovery is about today and tomorrow and forever. So when we think about and you ponder all the wisdom we're going to hear, please don't think just about what needs to change. Think about what needs to be institutionalized and how that happens. And finally, I wanted to remind us to think about the most basic barrier to getting help for mental health situations. It's fear, stigma, not knowing what to know, like who to call. Those are things we could do something about. A little later, and if you go to one of our other sessions, we're rolling out 2 new programs, Sharing Hope and Compartiendo Esperanza. And what those are video-based, culturally competent conversation starters to help people begin the conversation in a way that they're comfortable. We are really looking to do that for everybody, but we thought that those 2 would be a really good place to start. So just a word about our panelists. Dan is going to start off with just some background on, the national scene, what some research says, where we are. We'll watch a quick video. Dan Gillison took over NAMI about 2 weeks before the pandemic began. So that's a pretty short window of a short orientation. So what really has jumped out is that Dan immediately embraced a critical national leadership role at a time that we really needed that leadership. He was ready. He brings 30 years of experience, including serving as the ED or the leader of the American Psychiatric Association's foundation. Also a key executive role in charge of innovation for the National Association of Counties, leadership positions at Xerox, Nextel, and Sprint. What strikes me, though, is that NAMI is an alliance of many different voices and entities and leaders. It's a cat herder in chief job. And the way that I've noticed Dan Gillison leads is he leads by listening and he builds teams. and he is thoughtful about decisions that he follows through on. Those are qualities that I really admire, and I think that our coalition really needs. Now, the last thing is that Dan has embraced justice, equity, diversity, inclusion, which is JEDI. That's what NAMI is calling DE&I. And so and he's embraced it not just as a thing that we should do this year, but as a frame, as a lens for everything we do. So welcome, Dan. Department of Human Services Secretary Grace Ho is Governor Pritzker's go-to on human services. She's tasked with leading a multi-billion-dollar organization to get it to the next level during a pandemic. That's put every unit to the test, especially a very hardworking division of mental health. IDHS is complex. It includes family community services, developmental disabilities, substance abuse as well. The pandemic and the response to the pandemic really demonstrated Secretary Ho's ability to integrate all those things, avoid silos, and get the most out of the systems that we have. And I think what's really exciting is that now we're in a period of new investment in building, particularly in mental health. And so it's good to have her leadership on that. She's also a visionary. Healing Illinois, which is the administration's racial healing initiative. I don't think it would have existed without Grace Ho. I mean, this is the work of many people are working on this, but prior to coming to the state, Grace was the head of the Woods Fund of Chicago, which is the preeminent foundation for social justice and equity and direct empowerment of all people. If you were to look back at her history there, you would see the precursors of Healing Illinois go back to some of that work as well. She's a change agent, and her work is informed by her values. She is the child of immigrants from Taiwan, a parent, and I just think of her as an activist and doer to the core. So welcome, Secretary Ho. Finally, we have Metropolitan Family Services CEO, Rick Estrada, someone I know and have worked with and respected for many years. Rick also brings an intimate understanding of the immigrant family experience. What's always stood out with Rick is that he brings an empathy and a sense of service that allows him to connect to anybody. And that's an essential leadership quality. The other thing is his drive. I didn't realize until I played softball with him, because Rick's very soft-spoken, but when you see him wanting to win, Rick's a builder. When we worked together, I think Metropolitan Family Services served about 32,000 people, and I think it's around 90 or in almost 100 now. Metropolitan Family Services is one of the most comprehensive social service agencies in the state. They're a major employer on mental health, and they're also a major innovator. So one of the things Rick has been involved with is this thing, the Metropolitan Peace Academy, which has been a very thoughtful and comprehensive response to gun violence in Chicago, and that connects directly to mental health. So really glad to have him here. Prior to being at MFS, he was the first deputy commissioner at the Department of Children and Family Services for the city, executive director of Erie House. He's on the board of the U of I and many other foundations, Woods Fund as well. I think out of all the awards he's getting, I'm going to guess that the NFL Hispanic Leadership Award and didn't the Cubs honor you last year? Were probably some of the big ones. But I just wanted to welcome Rick. I encourage people to look at their bios. That's what I had to introduce us. I think right now, welcome everybody. And I think we're going to go straight to a short video, and then we'll hear from Dan.
My name is Sharita Cole Brown, and I have had a bipolar 1 diagnosis since 1980. My experience with mental health in the Black community has been as a child that it was seen as crazy. It wasn't seen as something that was acceptable. Black people, especially Black women, were always expected to be strong. There is the mammy stereotype. Mammy took care of your children, her children, cooked, cleaned, did whatever needed to be done, and all the while, she was smiling. All the while. And for Black women, we are not expected to break down. We're expected to just take it on your back. We're expected just to keep going no matter what. And when it came to mental health, that informed who I was. I had been in bipolar recovery for 25 years when I wrote my book. So when I wrote Defying the Verdict, I had dredged up all this stuff about being bipolar. Like, I was in denial. I don't want to talk about that. And then I decided that, I'm doing very well. I need to come forth and share. It was time to share. That if one person could get hope from my story and see that I was living well, then let's write the book. And I majored in English at Wesleyan. I took writing courses at Hopkins. Write the book. So I wrote the book in 2015, and that was when I connected with NAMI. And I heard people tell powerful stories of what NAMI had done for them and what NAMI had done for their mental health. And I knew that I had a powerful story as well. And I wanted to be part of this grassroots organization that had people actually sharing lived experience with mental health. I learned from NAMI that it's okay not to be okay. And there is a community of people that are waiting to help you. There are helplines, there are groups, there are all kinds of people that are saying, this is something that we're gonna overcome. We were whispering about mental health, mental illness, mental health challenges. We've gotten to a point where it's time to stop whispering. It's time to, as they say, shout it from the rooftops, that if you are not okay, NAMI has a plan for you that you can participate in, whether it be a course that you're taking, whether it be a connection support group with other people to talk to, whether you are dealing with PTSD and you're in the military, whatever it might be. We have in our own voice presentations where those of us with mental health concerns and illnesses can come forth and speak to you about how we can make this normal, how we can deal with this in such a way that having a mental health challenge becomes as common as dealing with diabetes, as common as dealing with a broken arm, that we know that it's okay to not be okay, and we create a culture where the way we do things around here now is that we are kind to our minds, not just kind to my mind, but I'm kind to your mind. And that is what NAMI, the organization, is all about. NAMI means, to me, that fewer people will have to suffer and struggle through mental illness because there are people who can go through and walk on the path with you and support you, making sure that you can be okay.
Thank you very much for taking the time to listen and watch that video, and for Sharita's overview in terms of what NAMI has meant to her. Every one of you all in the audience and our leaders that are on this panel care, and people don't care how much you know until they know how much you care. And we want to get to our panelists as quick as possible. But it's important that I stop for a second and just say thanks to NAMI Illinois, to the NAMI Illinois board and the board president, John Shotweiler, as well as NAMI executive director, Andy Wade, and state program director, Terry Latter. And to our panelists, thank you for your time. And I know you have limited time, so let's see if we can get to these slides. And there's only 5 slides, and I'll go over those, and then we'll open up with the questions. It's important that we get to what you're doing, how you're doing it, and what you think of the future as we talk about leadership, tone, and execution. So with that said, if we can have the next slide.
Ed, I think that's just the cover slide. I think we're going to go right into the body.
Next slide, please. Okay, so before COVID, what did we know? We had a broken system, very much like the storms of Katrina in New Orleans. We knew the levees wouldn't hold. The Corps of Engineers had said it for years. If the Cat 5 storm hit. Well, it's the same thing with what we've always called as the fragmented mental health system. So a broken system. 2 million people, 2 million times a year, people with serious mental illness are booked into jails. Average delay between symptoms onset and treatment, 11 years. So if you have a 14-year-old, they actually don't get treatment until they're 25. And then every 11 minutes, someone is passing from suicide. Nearly 1 in 4 people shot and killed by police officers between these 5 years, 2015, 2020, had a mental health condition. 1 in 3 were people of color. Let's go to the next slide. I'm going to really go very quickly because we're really setting the stage for our conversation. And why is equity, inclusion, and working across the entire community so critically important? Next slide, please. Inequities. You see the 4 bullets here in terms of 1 in 3 Black adults who need mental health care receive it. Only 1 in 3. Suicide rates for Indigenous youth are over double the rate of white youth. LGBTQI community is 2 to 4 times as likely to experience a mental health condition. Adults with disabilities report experiencing frequent mental distress, almost 5 times as often as adults without disabilities, almost 5 times. Next slide, please. The barriers, we know these. Let's just put them out front. Stigma, cost, distrust, bias, and representation. Who's sitting at that table, either as a decision maker or an influencer, that is representing the community? Next slide, please. Here's just some numbers real quickly from the standpoint of NAMI has a national helpline, and that helpline is staffed by volunteers with lived experience. And in terms of that helpline, year over year, from July 2020 to July 2021, what have we seen we actually measure about 12 different areas. And in terms of the impacts on the metrics of calls coming in for mental health crisis and suicide resources, 185% increase on calls coming in for suicidal ideation and resources, 251% increase on mental health crisis. So that's what we've seen year over year coming out of COVID. We have other metrics if you'd like to know more. Next slide, please. Now, this is the closing slide. And what I want to say here is that we've conducted a mood survey with Harris polling organization. And this is the link to the full survey. What you see here is a couple of infographics that are there. And what I wanted to do is I just wanted to mention the graphic in the top right corner. In addition to the structural barriers like cost and access to providers, stigma and lack of cultural competency can prevent people of color from getting appropriate treatment. Many struggle to be seen, heard, and understood. What NAMI says is we meet you where you are. So now, as you look at this one infographic, 77% of respondents who identify as people of color report it is difficult to open up to others about their mood disorder. Now, the biggest part of that is that 78% of that number was Hispanic, 77% was Asian, and 72% was Black African American, and 69% was white. I just wanted to set the stage in terms of what we're seeing and what has increased coming out of COVID, and we're still in COVID. So we're 20 months in. So this is all what we know, and that's why our work is so important, and that is why caring as much as we do is so critically important, and it gets into the execution and the scaling. So with that said, let me get to the questions as quickly as possible and see what we can do. And I'll start with Rick. And Rick, congratulations on all of the work that you do and how well you do it. As a major mental health provider for the state, Metropolitan Family Services has weathered cuts, seen the effect of inequities with much deeper roots, and managed the disproportionate impact of the pandemic. What do these experiences tell you about how to navigate change going forward? What are the lessons learned and the opportunities and challenges?
Dan, first of all, thank you so much. Thank you. Thank NAMI for putting together this important panel. It's a pleasure to be here with Secretary Ho, who I've known for a long, long time, and also with Andy Wade, who's been a colleague and a friend for a long time as well. Lots of questions there in one. Here's the sad truth about what's happened every time there's a crisis in the state and the country. And I've said this over and over, and it's in times of crisis, people, institutions fund those they most trust, right? So during these 20 months, MFS has grown actually in its scope and its services and the number of people served. But that's not a good thing necessarily, because that means that other organizations, smaller, have either lost programs or shut their doors. And it means, importantly, that small organizations led by other people of color are losing funding, and therefore it's creating additional stresses on their systems, on their communities, on individuals there. So that's, I wanted to begin there because, MFS has been around for 160 plus years. And I'm sure it will be here in another 160 years. I'm confident of that. And it'll weather the storms of change, and it'll take the lessons of the past to grow and continue to strengthen. But we are not going to essentially help the broader Chicagoland and state of Illinois area if we're not also, and at the same time, helping the smaller grassroots community mental health centers serve those they serve better and help them find funding and help them develop infrastructure. If we are not supporting them and mentoring them, then we are doing the city and the state of disservice, that is. So that's, I think, the biggest lesson for me, that it's, we don't want to look at growth any longer. We want to look at mentoring, helping, and supporting others, because at the end of the day, it's the grassroots organizations that are helping us, move the needle on this issue. And I know that's not exactly the question you asked, Dan, but I think that's the important topic when you think about equity today, is what are the big players, including government, doing to support and lift up the smaller organizations that need to be there, that are essential for our communities of color. So I'll pause there.
Thank you very much. And that makes me think of whiteboarding and actually almost having a room where you put on the board, what are those small groups that are vulnerable but are critical, and what do we need to do to the point of mentorship and supporting them and making sure they keep their doors open and actually putting a plan in place to do that versus the growth. And, you know, I always say, follow the money and you'll know how much people care. So I'd love to come back to you at some point and talk, how do we sustain them and what can we do? Secretary Ho, thank you. I'm going to ask you a series of questions in the spirit of time and your calendar, if you don't mind. So I'm going to go outside of process, but being respectful of your time, that's what I'd like to do if you're okay with that. So starting out with this first question, prior to coming to the Illinois Department of Human Services, you worked in philanthropy. And before that, in the community at Chinese Mutual Aid and other grassroots organizations. How have those experiences, shaped your understanding of mental health needs, the role of culture in addressing stigma, and unmet needs? Sorry to ask you a series of those in one.
No, thanks, Dan. And it's a pleasure to be on this panel with you and Rick, and thanks, Andy, for welcoming me back. I consider Rick a brother, and on my path and journey over, you know, working in the Immigrant Refugee Service Organization as well as in philanthropy, my journey has always in some way included Rick alongside me. And so I think, you know, my understanding around the needs of people as it relates to mental health has probably grown and evolved over time. And I think what I believe is that there is stigma in all cultures related to mental health and the acceptance of mental health. That it's a societal stigma, it's a global stigma, struggling with misunderstanding, limited access, and of course, questions around quality. And I think most importantly, as many of us have in my own family, I think lived expertise is probably the most profound learning experience, right? Learning, unfortunately, in the hardest ways around how people struggle with mental health. And so I think that applying all of what I've learned and experienced and from other people within the Department of Human Services, what we're trying to do is to try to create career pathways for people with lived expertise, for people who have been on the journey of recovery over long periods of time. You know, I was very moved by what Sharita was talking about, that there is a road to recovery that we know exists. We know that many people are not even able to find that path, but we are actively trying to identify systemic ways to ensure that people with lived expertise can be the ones to guide others into recovery, and to guide people who look like them and not just have experienced mental health issues, but also who live in their own community, who have the same backgrounds, who speak the same languages, and who come from the same cultures. And so I would say that, you know, the work that we're able to do now at DHS in partnership with a lot of the amazing leadership at DHS is kind of a conglomeration of everything that I've learned working very deeply in the community and in philanthropy and in grassroots organizations, hearing from community organizers and having it really be an amazing opportunity to bring a lot of that to fruition as the secretary at DHS.
Thank you. And I want to build on that question. And Andy, come to you after this question with Secretary Ho. Grace, you have dedicated your career to advancing equity and social justice. Can you tell us more about your work, and more specifically, can you tell us about how the Healing Illinois Equity Agenda came about? And what are some of the points of connection to mental health and health equity?
Well, so, and Rick could probably answer some of this question as well. So when I was at Woods Fund Chicago as the president, first and foremost, it's important to say, and Andy, you did an amazing introduction, Woods Fund funds community organizing and public policy advocacy to fight poverty and structural racism. And they do that, we do that through funding community organizations and community organizers, people who are impacted by policies that government and other legislators are trying to enact on their behalf. But I think what Woods Fund does is to fund them so that they can be at the table. And as a part of that work, we were really exploring the way that restorative justice and healing could be a part of that journey, could be a part of reckoning around issues of racial justice. And so Woods Fund was identified by the W.K. Kellogg Foundation to be a part of the Truth, Racial Healing Transformation Initiative, picked Chicago, one of 14 different locations across the country, to really advance this notion of racial healing as a way to transform and as a way to impact systems in a positive way and towards racial justice. And so Rick and I, and actually I think it was about a dozen others, traveled to California with other racial healing practitioners to learn about what racial healing is and means. In a nutshell, I would say that I became a believer in the need to not only attack policy change in an aggressive way, but to actually understand other people. And it sounds so simple. And Rick has said before, and it always resonates with me when I talk about this, is that the shortest distance between two people is their story, right? And in essence, racial healing is very much like that. How do we know each other as people as opposed to someone from a different tribe or a different community or a neighborhood? Because when you get down to it and you get to know people, you realize that the distance between us is actually non-existent. And how, in a country like ours, where relationships and networks matter very much and change comes with it, with greater understanding of different people's experiences and understanding that what divides us is actually not very substantial. The theory is that systems change and policy change can come along as a part of that. It is not the only solution, but it is necessarily a part of the solution. And so when we had the opportunity in the midst of the pandemic in the summer of 2020 to see how much harm and terror and sadness and tragedy was befalling communities of color in particular, we took the opportunity to really put out, I think, the only ever state-funded effort to promote racial healing and understanding in the summer of 2020. And we worked in close partnership with philanthropy in order to put that out. And so I think healing and reducing harm is a necessary critical component of mental health recovery as well. So I think that there are a lot of synergies between, the work that we're talking about today and racial healing.
Thank you very much. And
Add a little bit to that.
yes, I would love for you to do that. Thank you very much, Secretary Ho, for your leadership and for the state's leadership on racial healing. Rick?
Yeah, and obviously Secretary Ho is so extraordinary, but when we worked on bringing to Chicago and the state of Illinois the Truth, Racial Healing and Transformation initiative that she just talked about, because there's been so much historical trauma in our city, in our country, I think our activists, our people that want to change policy, that want to change laws, focus on the two T's, right? The truth and the transformation. And there's an urgency to tell the truth and also an urgency to transform. But a lot of the time, I think what we need to work to help everybody understand is, yeah, of course we want that too, but that racial healing part has to also happen. And that's, I think, some of the brilliance of the work that DHS, through Secretary Ho's leadership, that focusing on that racial healing component that has every element and connection to mental health is critical moving forward. So again, respecting the need for urgency and truth telling and transformation, absolutely, we want to get there. We're urgently working at that too. But without that storytelling and realizing our common humanity, it's hard to transform. So again, Grace, thank you so much for the work that you've led, not only at DHS, but throughout your entire career on that. So I just want to make sure I pointed that out. I know that I wanted just one more point. and we've talked about this over and over when it comes to mental health, and this is perhaps the single most important thing I want to say today, and it's when somebody is diagnosed in mental health in our family, we somehow feel like it's our fault, and we almost want to hide it. We don't want to necessarily tell people that it's going on. And by the way, we all have, every single American has lived experience with mental health, and you know that, and we all know that. And so in our work in violence reduction and peace building, lived experience is one of the most important things that we call for. So when people are interrupting violence or they're doing street outreach work, we want that lived experience to inform our practice to then bring peace to our communities, right? So why is it then, if it's so important in peace building, that it's not equally important in the work of mental health, that people with lived experience, that, and every one of us in our families has it. And I know the people on this panel, and I know each and every one of us has real lived experience, and it's been painful and hurtful. So it is inspiring to see leaders at the state level and at NAMI and at big nonprofits that have people with lived experience. But how do we now take that lived experience and recognize it all across our city, our country, and lift that up and then start this healing process, because it's just not happening. The last example is when somebody in our family has diagnosed with cancer, for example, everybody rallies around them, and people know about that. We raise money, we call them champions and warriors and healers, and we pray for them in circles. But when somebody in our family has mental health issues, I don't see the prayer circles happening, and we're not calling them champions when they go back to work. And again, it's just like this dissonance that's going on with a issue that impacts all of us, and we simply want to hide it. And yes, there's a whole lot more of awareness than celebrities like Britney Spears and Dwayne Johnson, and in Chicago there are people like Brandon Marshall, who was the Chicago Bear, bring it to the fore. And sure, there's awareness, but we need to take that next step into the healing part.
Thank you, Rick. And we're going to go to Andy next, but I want to mention something that we just did. We had I'd like to bring into our all staff meetings, Voices from the Field, and we had someone come in and meet with us that actually is a psychiatric nurse, and talked about their work. And they did a presentation on compassion fatigue. And I'm mentioning compassion fatigue because as you talked about mentorship and support for, and you just mentioned what we do when someone has been diagnosed with cancer versus what we do with someone with mental illness. We also have to look at how do we help with that compassion and that support of those small organizations there that have leadership, that we want to make sure their doors stay open. All of us manage, navigate, and we all need to be supported. So what do we do to support them? So I think that that's something I just wanted to mention in this conversation. We said we wanted to make sure that this was like an executive conversation. I appreciate the leadership of Illinois and what they're doing, because you're constructing a quilt. And with a quilt, there's a common thread that runs through it. There's one thread for each patch. And it's just, how do you construct it to make sure that it's scalable and that it is executing everywhere it needs to be? So it's a work in progress. Andy, I've got two questions for you. First of all, you are sixth generation Illinoisan, have pursued doctoral work in educational leadership, and bring more than 25 years of leadership experience in social impact organizations. What misconceptions do you think people have when they think about leadership in the mental health space?
Well, thanks, Dan, and thanks, Rick and Secretary Ho, for bringing your personal experiences. The thing that, well, first I want to say, people tend to think of NAMI Illinois as a big organization because we've got this national brand, but really we're a very small organization, probably too small, but we don't need to be that big because we're a network of affiliates, we're an alliance. And if you're trying to build an alliance or lead an alliance, you have to really start by paying close attention to what people are saying and listening, because leadership can come from anywhere. I think that's we're a science-based field, mental health, but NAMI's not a clinical organization. We're a support organization. And I think in a science-based field, we tend to look to experts. But I think where the expertise is really coming from the people that we work with. And it's from us, from people with lived experience. I mean, NAMI is in the public conversation of mental health. And so listening very closely to, and looking for it wherever it comes. The other piece, I think, is just that context matters. The issues that are going on in rural Illinois or for people in the LGBTQ communities, many different communities, it matters. And I think, like with stigma is universal, but how it expresses can be very cultural. And so how we work on things in one community might be different than others. And, I'm a white guy leading a statewide organization. It's not appropriate for me to try to be a leader in every situation. We got to listen. The other thing is I always just look for who's doing things. I mean, that's one of the reasons why I wanted our panelists, is because I've been around long enough and I know who does things. And this is, leadership is people who step up. And so we've seen a lot of, for all the challenges last year, we've seen some heroic action. And a lot of places where that's coming from are the neighborhoods that we think of as marginal. Some of the best leadership I know is in the west side of Chicago from an organization I worked with that is a lot like Rick's Metropolitan Peace Academy. That's what inspired me to get into this. So leadership can be anywhere.
Andy, another question here. It's not scripted, but I'm going to put you on the spot. Is you had options on where to take your skills and your competencies and attributes. Why did you bring them to NAMI?
I have lived experience. I actually don't talk about that because it's hard. It's hard. But having gone through this and having really worked through 20 years of major depression, after a while, I actually got better. It's still, people work with me. I'm not all that better, but it's the healing is possible. And it took a lot of hard work. And for me, that was my story, but I think that that's the story everywhere. And I had the opportunity, I was actually working with another former colleague of Rick's on the Southwest side doing frontline stuff when the pandemic hit. And I saw an opportunity at NAMI. My pet idea was specifically, we need a workforce program to directly pipe people who are doing frontline community work into our workforce. And this was the idea. I went to a workforce organization to learn a little bit about that. And NAMI is a possibility to make a change on that. And so there was no hesitation in taking that.
Thank you very much for that, Andy. And this is about us supporting our leaders. So, it's okay for me to talk about it. It's another thing for me to demonstrate it. So what I'm talking about is exactly why I asked that question in terms of our leaders. So, we wrap our arms around your leadership, and thank you for answering the question. You just mentioned workforce. We're hearing about long time shortages in the mental health workforce. Can you speak more about workforce and the shortages? And then Secretary, I'll come to you next.
I'll be brief because I think that one of the organizations I know that we all work with has been really leading the charge on workforce. And this is an excellent time to move on workforce, and we need to. Well before the pandemic, the workforce was in crisis. I know the organization that worked, or in the coalition that put that report out, there was a report that was dated 2020, but I think that they worked on it for 2 years. And it was showing that there was a massive shortage in every position. And I think it was Rick who said earlier, in times of shortage or crisis, inequity grows. And if you look at where the shortages are, it's in the Black and brown communities, Asian communities, but also rural Illinois. Our our DEI model is very intentionally not just about race and identity. It's also about region, because rural Illinois is suffering. So anyway, that's a speech. That's not necessarily the facts. One of the things I would like, we've been working a little bit with the department on workforce. We have some great workshops coming up on that, actually. But the piece that I see is the people with lived experience. Maybe Secretary Ho can talk a little bit about the expansion of the CRSS program.
Mm-hmm.
But I think that pairing that with something to get, folks from the gang intervention community in, but also from primary care and community health. We're working with Sinai Urban Health on community health workers, and helped them sort of work on the mental health piece of that. But we think there should be a mental health community worker. So there's a lot of options, but Secretary Ho, you've got a great one going on right now.
Well, so I would say that it is one of the greatest challenges that we have right now for our behavioral health system, which is the workforce shortage. And we walked in the door, this administration in 2019, with that challenge, and has only been exacerbated by the pandemic. And so there is, just like other really hard challenges, there's not an easy solution. I think I think as many folks know, we've increased funding, we've stabilized funding in certain ways. We were coming off kind of several years of budget impasses, and the Health and Human Services system was victim, I think, in the greatest sense from that, those state budget impasses over the past previous years. And so we were just trying to get our foundation settled when the pandemic hit. And so we've been engaging with, the association and the trades and community-based organizations to really figure out how we can identify immediate needs, right? And immediate solutions, but understanding, as Andy kind of laid out and you did as well, that we need to look for the long term. Like, we can't continue to operate in crisis mode. And so what we've done in partnership with Healthcare and Family Services over the course of the pandemic in particular is just increase funding, right, in flexible ways for community-based organizations, community mental health centers, to continue to provide services. We've created flexibilities with telehealth opportunities, and have found those to be actually quite effective in certain instances. Obviously, face-to-face, human-to-human is critically important, and you can't replace that in every instance. But we have found that telehealth and like the call for calm to be helpful in certain circumstances. So I think we need to continue to innovate and push our system to modernize and to grow. But also we need to increase the pipeline, right, of workers. And we need to think creatively about retaining workers in the public mental health system, because we are competing, right, with our private sector partners. But I think if we are truly to address issues of inequity, I think to Rick's point, we need to invest in neighborhood organizations and community-based organizations. We've talked a lot about in this session around how we're trying to broaden the pipeline for individuals who have lived expertise and experience to enter the behavioral health workforce as a professional. And so we are increasing the number of individuals in Illinois who successfully obtain either the DMH Certified Recovery Support Specialist or the Substance Use Prevention Recovery Certified Peer Recovery Specialist. These are two credentials through the Illinois Certification Board. And we have actually right now a notice of funding opportunity to release $8 million worth of grants to broaden this pipeline and to increase the number of these certified individuals who will be employed by mental health and substance use providers and receive funding from the state of Illinois. We're really excited about this. We're hoping that we're going to be seeing a lot of creative partnerships. And the other thing that I want to say about this behavioral health workforce shortage is that we're also experiencing it at our state operated hospital side as well. It's not just one part of the system that is being challenged in this way. you may know that as a part of the Illinois Black Caucus agenda this past spring, legislation was passed to create a behavioral health workforce center. And the Illinois Board of Higher Ed is working with us. We are going to be working very closely with Southern Illinois University as a primary hub for this behavioral health workforce center, and then also engage the University of Illinois Chicago as a secondary hub as well. And so there is deep recognition of the shortages, not just in the executive branch, but also the legislative branch as well. So, you know, and we're hopeful that with this center and this increased awareness, and in fact, there's a subject matter hearing that we were just invited to talk about this next Friday. So people know, and I think that that's a credit to the advocates and the organizers to really lift this up as an issue. And hopefully with that spotlight, we can think about some long-term solutions.
Thank you very much. And I think that this is very exciting. And what you've talked about is the construct of that quilt and that tapestry. So, and I'm sure the audience will really want to know more about the $8 million of grants that are going to be provided and the certification process. So, and you're so right, as we bring talent in the front door, we got to make sure we keep it and it doesn't go out the back door. And that's a big challenge. One of the things I forgot to mention is that this is so important. I get my energy off the industry of people. So it would have been wonderful to be with you all in person, and navigating and managing through technology has been something I've adapted to, but it's not something that I've lived well in for my own mental well-being. I miss the interaction and the industry of people. I also want to say that my wife is adopted, and she was born in Springfield, Illinois, and her name was Baby Girl. And raised in Louisiana, but born in Springfield, Illinois, and we were able to get the birth certificate. So I am connected to you guys in more ways than you would ever imagine. So with that said, I want to go to Rick, and Secretary, I know you've got about 7 minutes, so we'll come to you because I want to ask you about 988 and want to ask all of you all. Rick, MFS has been a leader, not only in addressing gun violence, but in developing talented young people of color who work in those challenging roles. What are some lessons learned from Metropolitan Peace Academy? We've heard about it a couple of times in terms of MPA. What are some lessons learned from Metropolitan Peace Academy in workforce development, professional development, and that thing you mentioned earlier, mentoring?
Yeah, Dan, thank you again. And I know that Secretary House has to leave quickly, but here's a couple of things on the workforce side, and then I'll get to the lessons because they're related on the Peace Academy. So we, on any given day, we have over 150 job openings at Metropolitan Family Services. So just think about that, 150 job openings in critical positions like behavioral health caregivers. And the hardest thing for us to find right now is an MSW, LCSW, who's African-American, and then the unicorns are LCSWs who are Latino, Latinx, and bilingual. I mean, that they're unicorns right now because the hospitals and FQHCs will swallow them up and are able to pay a little bit more than we can. And given the stress, the economic stress on our society right now, they're willing to leave us for $3,000, $4,000, $5,000 without our opportunity kind of to think about that and how to wrap our arms around them. So that's one of the workforce issues. The other one is, it's not the mental health that I grew up with 25 years ago. When I came into the field, I thought I'd be a clinician, right? I studied to be a clinician. I was a licensed social worker, never got my LCSW at the time, but I was practicing, and we didn't have all of the reimbursement requirements that we have today. There was a lot more grant funded mental health at the time. Today, it's pretty much fee for service. And what has become a culture of accountability has also created a culture of bureaucracy that these people don't want to deal with, right? They don't want to deal with seeing a client and then writing up paperwork for another half an hour, making sure the insurance codes are correct, And I feel like the insurance industry, part of their economic model is to reject the service. And then we then go into trying to appeal and get that money back. So all of these issues are conspiring against our workforce, frustrating them and forcing them to leave our sector because they could get paid just as much somewhere else for a less stressful job. We can work on the pipeline all day. And I represent the University of Illinois as well, and our 3 universities. However, if we don't deal with the pay issue and to figure out how to make the paperwork more efficient for them, I think we're fighting a losing battle on that front. So that I wanted to speak to that. In terms of the Peace Academy, essentially we're trying to professionalize the field of street outreach work through this Peace Academy. And so for over 100 years, there have been outreach workers. Some people call them interrupters, intervention workers, depending on which region of the country you are. There are different names for these individuals, but essentially people with lived experience that know the line between their former life and this new work they're trying to do to bring peace to the communities. It's a tough skill set to acquire, and it's a very difficult individual to find that understands that line. We want to train people through 140 plus hours of training where they get city colleges credit for going through that training. They'll get multiple class credits through city colleges. We're doing that. Our goal is that, one, they become expert and recognized experts in the field. Most of these people are of African-American or Latino descent, not all. Most of them are male, not all. But we want to professionalize them so they could then move on to other jobs. We also, in working with places like the Jane Addams School of Social Work, Northeastern, Chicago State, trying to get them into college so they move on. We don't want them to be street outreach workers forever. We want them to move on to other professions, including our mental health sector. Now, Jane Addams, as you know, is one of the great MSW programs in the country. And so trying to get them through the Jane Addams program and then into this sector where they could theoretically make more money, but not always, which is, again, brings us back to the workforce and the investment issue. So, you know, we have the potential to build a pipeline of Black and Brown clinicians that have the most relevant experience, that are dealing with immense stresses in their own life because of their lived experience. And so also providing them the mental health they need to be successful while doing an almost impossible job of keeping peace in our communities today. I mean, that's our challenge, and that's one that we embrace. And we have a partnership with 14 organizations that all send their outreach workers to our Peace Academy, where they're getting the training, where they'll get college credit, where we'll then move them on to colleges, universities, and hopefully bring it to our sector.
That's fantastic. Those are 14 patches on the quilt. That's fantastic. Secretary Ho, as you get ready to leave, we apologize that you won't be able to be with us, but this last minute, you just put $40 million into 988 PrEP bolstering for the community. I want to ask that question, but more importantly, I'd rather give you the floor to see what you'd like to leave this audience with. That is a question love to ask you, but you only have this period of time. So what would you like to leave the audience with?
Well, thanks. I do want to talk about 988 because I do think that it could be truly transformative for Illinois and for a lot of the issues that we're talking about as it relates to equity. Dan, we actually put out $71 million in grants this past year for the crisis continuum in Illinois, which is actually the largest investment in Illinois history. And so I think that we know that that is a critical investment to build a foundation for what we will need to do for 988, right? And it has potentially it has the capacity to be the largest impact for benefiting people that we currently serve, as well as those who have not had access to mental health crisis services in Illinois. So, and again, you know, we're going to be leaning on our community mental health system. organizations like MFS and the other not, the other patches of the quilt, as you say, Dan. And this comes after, many years of disinvestment. One of the things that I kind of wanted to pick up on what Rick said, which we saw during the pandemic, is that organizations needed flexible funding to be able to determine where in their system, where in their organization these investments were most needed, which I think we did, I think, our best to build capacity in that way. So the last thing that I just wanted to say was kind of the intersection of mental health and the criminal justice system, right? And so one of the reasons actually that I need to jump off is because we are continuing a very close relationship with the Illinois Department of Corrections. Director Jeffries and I have built a very close relationship since we started. And what we recognize is that we serve the same community members. Unfortunately, we know, as Dan had shared, that there are a large number of people who are suffering with mental illness, who are suffering from severe and persistent mental illness, who are actually being served by the Department of Corrections. And his vision, my vision, is to work together to make sure that more people could be served in the community, that they do not have to enter into a correctional facility to access mental health services. And I think the other piece that we know as it relates to equity is that those are Black and Brown people who are falling through the community mental health system cracks and falling into this correctional system that is not going to necessarily put them on the path towards recovery. And so how do we undo that, right? And our forensic mental health system was also severely damaged in previous years, and we're also continuing to build that up as well. And unfortunately, it's a growing industry. More of our state-operated psychiatric hospital beds are forensic, leaving more limited capacity for our civil capacity. And there are no easy solutions, but we are committed to doing our best to creating a stronger, more equitable system for the future. And I'm so sorry that I have to leave, but I really have deep appreciation for all of you and for welcoming me to this discussion.
Secretary, thank you very much for your leadership. Thanks for giving us your time on today, and wish you the very best as you execute on all of this going forward. And hopefully I'll get to meet you sometime in person. All the best. Okay, coming back, I want to mention 988 as a father. I want to mention to the panelists in the audience, as a father, I don't have a number I can call. This is not emotional. This is fact-based. All I have to do is look at the statistics. And there's a sense of urgency for me as a father and as an uncle that there be a number that I can call if I have a loved one that's or one of my nephews or my son or my daughter, and they're having a mental health crisis. Right now, I cannot call 911, and that's not because of any. I used to work with law enforcement very closely, IACP, National Sheriff's Association, and have very close friends in law enforcement. So this is not against law enforcement. It's just not the response that I think that, based off of history and data, will serve my family correctly if, in fact, there's someone in a mental health crisis. So why am I saying that? Because there's a sense of urgency, and NAMI is going to have a week of action, the week of November 15th, looking at 988. And it is going to take all of us, and 988 is more than just a number. We have to look at the front end of it in terms of development of workforce, and also development of a crisis hotline, 24/7 hotline that can be used. And the talent to manage that hotline, to work that hotline, then the mobile crisis stabilization units themselves. I live around the corner from a substation with 30 cars. For every 5 patrol cars, it'd be great to see 1 mobile crisis unit. Those mobile crisis units have to be staffed. They have to be staffed with LCSWs, and where's that workforce going to come from? Now, after you staff it, and then you go out to actually de-escalate an individual, and that's decompensating, where do you take them? So where are the crisis stabilization centers around the country? Where are they in the communities? And if they're not there, will we be ready on July 21st? I think it's a work in progress and it's going to take time. And there's a lot that won't be there on July 21st of 2022. With that said, I want to come back to a question as we go for the wrap up. Hopefully you all are very comfortable with this conversation that we've had. Andy, with more people suffering now than ever, Illinois needs ongoing efforts to replace stigma with awareness and provide a clear path to accessible support. What is NAMI Illinois doing to enhance culturally competent public engagement?
Thank you. Well, I think what we're doing is we're working with national and with community. Right now, I mean, our JEDI plan is to focus on a few key issues. Workforce is one, community peer workforce. The second is to build relationships. We really want to see almost like an affinity group model for what corporate D&I does it really very well. We need that for all of our mental health constituencies, and we need it statewide. But because those things build the infrastructure for people to come together and solve problems and tackle stigma. A lot of what stigma comes from is a lack of understanding of what the what is, but I think it begins with fear. And so I'm really excited about Sharing Hope and Compartiendo Esperanza. I know these are both programs that existed before, but what NAMI did was it went back to the drawing board, and the people who created the videos are the videos. I mean, this is people talking to each other. So Sharing Hope is targeting African-American communities, Compartiendo Latino communities. So they're videos to facilitate conversations, but what we're doing right now is we're training a first cohort of facilitators. And this is a good opportunity for us to make more relationships in communities. That's actually, we had some money from you and we mini granted it right out. We could use some more because we're working with 9 affiliates, but really, if you look at it around the state, there's a lot of stereotypes about where people of color live. You know, Aurora, Waukegan, Springfield, you know, so we need a bigger strategy right now. We're kind of in launch mode, but that's getting that program just to encourage community conversations the way that community wants to have a conversation.
Yeah, social determinants of health and social determinants of mental health. We were doing a presentation with an organization, American Heart Association, yesterday, and we were talking about that 5 miles can separate 20 years of life. 5 miles, zip code matters. So and thank you for what you're doing, how you're doing it, and what you and your team are absolutely all about. And whatever we can do in support of you, we want to make sure we do that. To both of you all in closing, first of all, to the audience, I saw in the chat that was asked about compassion fatigue. We will send the compassion fatigue information to Andy, as well as the name of the presenter. And this presenter is also a person that was on a NAMI board and is doing quite a bit of work in the field. So we will send that so that NAMI Illinois can get that out to the audience if you'd like to have that deck and the name of the presenter. Let's close with this last question, if we might. And to our staff that's managing the call, do we have time for one last question? I'll take that as a yes. Ed,
no, I believe we're going to get cut off in a minute.
Okay.
Okay. Well, in summary, to the panelists, thank you so very much. It's a pleasure to meet you, Rick, and I hope to meet you in person as well. And the nobility of your work is way past the Chicago White Sox, I think, or was it the Cubs, and as well as the Bears. Kudos to them. But the nobility of your work passes them. They need to give you an award every season, every year. So, and Andy, thank you for your leadership, and for both of you all, and for the staff that put this together. I'm honored to be here with you, and really challenged to continue to do this work. And hopefully you all were okay with my facilitation of this panel.
Yeah, Dan, I just want to say thank you to you. Thanks to Andy and NAMI in general for putting this panel together. I know we're going to get cut off, but the stigma that we talked about is real. You talked about the barriers to mental health, and we know what they are: their costs, their the stigma, the fact that people think they could handle this on their own, and then just people don't know where to get their mental health. I think the stigma has a lot, is the greatest one of them all, because people who say they can get through things on their own, there's stigma behind that. People who say it's costly, it's true, but there's stigma behind that already. They don't want to necessarily explore the cost. So we need to continue to do the work that NAMI has done so well, that DHS has done so well in the state of Illinois. We need to continue to destigmatize this. And in addition to that, then we have to address it from the equity perspective, whether it's rural Illinois, like Andy talked about, or the west side of Chicago, or the immigrant community of the region. We need to move it to equity, because when we talk about Zoom and other platforms providing allowing us to provide mental health in a different way, especially for issues like anxiety, which may be taken care of better through the electronic format. What about in rural Illinois or in parts of the city where you don't have access to broadband and you don't have the devices? So it creates yet another barrier to this desperately needed resource. So I just want to applaud the work that NAMI is doing, and thank you for facilitating. And Andy, thank you again for this important work.
Thanks, Rick. You're important to me. And Dan, we're just so pleased with the leadership coming out of National. I just sent a little commercial for the rest of the conference. If you look at that agenda, that is a meaty, robust agenda. We have over 100 presenters, and we are tackling all of these topics. Some of them are educational, but I'll tell you right now that our workforce strategy is 2 workshops right now. We'll pass them together, and that'll be a series of recommendations. Architecture for inclusion, and then tomorrow it's community models. But I mean, there is a meaty, robust community of leadership already there. And it's really not about, this is about everybody. This is all of our job. And I think that we can come together. Grace said it really well. We are a lot more alike than different. But equity means everybody gets what they need. And if people aren't getting what they need, we got to do more. And we got to come together. The solutions are there. You build systems by design, and that's what gets me so excited. So everyone who's watching and who's participating in this, you're part of this. And I'm so grateful that you're there. And I just want to thank everyone, and enjoy the show. We'll keep going.
Andy, this is a great model. We're going to take a lot of what you're doing, and we're going to look at it for our national convention in 2022. So you're right, your programming is great. I'll just close by thanking you all, and you said together. So it makes me think of this African proverb: if you want to go fast, go alone. If you want to go far, go together. And we want to go far. So we wish you all the best. Thank you. I'm again very humble to be with you, and thank you very much. To your audience, thank everybody that's investing the time because they care about this and they're doing this work. So thank you for what you do to make a difference. All the best.